So, you get in there so you can show. So what we want to see whenever you have somebody in posture, what we want to see is the middle of the hip in line with the middle of the knee and the ankle, your lateral malleolus there. And if that's happening, then you're in good hip position. And then that will help determine where your shoulders and neck and head are. Because if I start to come like this, which a lot of us do, I start to round my shoulders and my head goes forward and then I tilt back. So a lot of people have headaches, lower back pain, hip hip tightness, hamstring tightness, calf tightness, and make sure. And then they're leaning forward, so they may have plantar fasciitis, they may have tingling or numbness in their toes, they may have blood flow issues. So posture is really important. So if we look at Allie here, so look at her from the side, you can see that the middle of her hip is in front of, if we draw a line right down, it's in front of her ankle. Now that's how she stands. She's not trying to put on a show, that's just how she stands. So see how hyperextended she is through here? And see how those calves are just really pushed back? They shouldn't be like that. So what we want to do is we want to show her how to bring her pelvis back. And so actually don't even do that yet. What I want to just do is I just want to bring your whole body back, just like that. See that position now? And now relax this. Your core tight. Now what we're going to do is I'm going to have her push down against my fingertips with her shoulder blades. So I'm going to push my fingertips up and she's going to push down while keeping her stomach and core tight and not extending back. So what would be wrong is if she tried to do that and she did this. We wouldn't want that. So we want that nice and tight right there. We want these down right there. And now if you look at her from the side, look at that perfect posture all the way down. Her head's in a great position. That's going to take the strain off her neck. It's going to take the strain off the base of the skull, with all these things that cause neck pain and headaches. It's going to take the strain, come around, off this area here, in your upper traps, in your upper thoracic area, which people have a lot of tension in and discomfort that goes right up into the neck. That's going to take a lot of the tension away from the lower back. It's going to, see how these aren't so hyperextended now? See how those aren't pushed way out like they were before? That's going to create better function in her ankles and foot, and her plantar fascia, and their hamstrings aren't going to have to work so hard, and their hip flexors are going to feel better. And now we'll show you how we do that.